I just want to talk to you a little bit about the common assessment in relation to diabetes. So I might just prompt you through what's currently on the common assessment and things that might alert you to people that might possibly be at risk of developing diabetes. So we know that diabetes is a condition that slowly occurs over a long period of time, and quite often people are working towards that condition long before they actually realise that they've got diabetes. So some of the things that start to occur in that pathological process is that people start to get things like hyperinsulin production, so lots of insulin being produced because they quite often have a bit of central obesity, so extra weight around the middle. They quite often have pre-existing high blood pressure. They quite often will have some of the early warning signs moving towards cardiovascular disease. They may in fact have some depression, which contributes, I don't know what comes first, the chicken or the egg. Nobody seems to know diabetes is closely associated with depression. And a condition very, very early in the kidney disease process called microalbuminuria. And for those of you who really love Greek words or old Latin words, it means really small amounts of protein in your urine, which you're not going to be able to know the difference, your client's not going to be able to know the difference, but what's happening is that the nice filtering system in your kidney is slowly releasing tiny bits of protein that nobody knows about. So those are some of the early warning signs of diabetes that may not be that transparent, but I just want to get pop a few things in your mind to get you to sort of start thinking alarm bells if somebody's got pre-existing cardiovascular disease or somebody's got pre-existing hypertension, a little bit of depression. Some of those things, it's kind of a bit like joining the dots really to try to figure out whether this person's at risk of diabetes or not. Something that I ongoingly ask clients is whether they've got a family history of diabetes. We know from research that there's, in terms of type 2 diabetes, which is the most common diabetes out there, that if one identical twin had type 2 diabetes, then there was an 80 to 90% chance that the other identical twin would have it. So there's that strong family association. However, that's not always an indication of diabetes, because in the past, people weren't tested as frequently as they are today for diabetes. So sometimes that can quite often be missed or misled. So one of the other questions that I sort of ongoingly ask is, what did your parents die of? And if their parents died of cardiovascular disease, automatically that rings alarm bells. Did they have undiagnosed diabetes? Because diabetes and cardiovascular disease go hand in hand. The thing that sort of I want to ring sort of little alarm bells in your head are people that, and talking about the signs and symptoms of diabetes has actually gone a little bit on the wayside, because some people don't have any of the symptoms at all. But I just want to remind you a bit about the symptoms, because that might help you join the dots. Oh gosh, I think this person might have diabetes when all other things have been discarded. So people that have infections that take a long time to heal, chest infections, urinary tract infections, periodontal infections that Mary most kindly mentioned, all of those things can kind of prompt you to think, you know, this person is going for long periods of time and nothing's actually, you know, the antibiotics that they're on is not actually working. And if people have elevated blood glucose levels, as Mary very aptly put earlier, their white blood cells don't fight infection as efficiently in an environment where there's high glucose levels. So things like boils are really, really common. I see people that come in that have boils that they need cut out or something like that, that quite often will prompt you, look, this person might actually have diabetes, and has that been investigated? Steroids, and I'm talking about injectable steroids, tablets, topical stuff doesn't tend to have a major impact on blood glucose levels, but certainly steroids will, and can quite often, if somebody's got the genetic vulnerability to develop diabetes, steroids will shoot their blood sugar levels up. And if people are sort of getting some of the symptoms of diabetes, or they're not feeling very well and they're on a steroid, get them to go back to their doctor and actually be checked, have their blood glucose levels checked. Hopefully the GP will do that routinely. However, that may not be the case sometimes. So maybe just a little bit of prompting from the client to the GP can actually help them be identified. The old 3 T's, the old-fashioned 3 T's, thirst, going to the toilet heaps and feeling tired, are also some of the symptoms of diabetes which people might have, and quite often they're overlooked because people put it down to, oh my God, it's Christmas and I'm running around like a crazy person, drinking heaps, so therefore I'm going to the toilet heaps. But if people complain of going to the toilet more than once or twice overnight, I would start thinking, oh goodness, when did you last have your check for diabetes? Blurred vision also happens when you've got diabetes, and I've seen patients that have gone to the optometrist a number of times and bought numerous glasses and they don't seem to work. Basically because they weren't investigated for diabetes first off. And what happens is if your blood sugar levels are high, it upsets the concentration within your blood and fluid fills into the lens of your eyes. That's a very transient thing. So when the blood sugar levels are stabilised and go back to normal, vision quite often goes back to normal. So the $200 or the $400 pair of glasses goes out the window, which is very sad indeed, especially this time of year. All the common signs and symptoms, all the common risk factors for diabetes, people know fairly well, but I've handed out a little brochure just to prompt you when you go away from here, because you've had an awful lot of information this afternoon, which I'm really aware of. That Indigenous Australians, people from Southeast Asia, Middle Eastern countries, some of the new African people that are coming here that are refugees quite often have a high incidence of diabetes. Maori populations, Polynesians have a high incidence of diabetes. People from Mauritius have a really high incidence of diabetes. Southern European countries, your Italian, your Greeks, your Maltese, quite often those populations have a very, very high incidence of type 2 diabetes. People have a family history of diabetes, or a history of gestational diabetes, or a history of delivering a very large baby are also at risk of diabetes. People who have, women who have had polycystic ovarian disease or have polycystic ovarian disease are at very high risk of developing diabetes or having diabetes. Central obesity, so people that tend to put on weight around the middle are genetically more predisposed to developing diabetes than the rest of us. So those of you who complain about putting on extra weight around your hips, you're genetically advantaged in terms of your diabetes. For those people, congratulations, that's great. People who have low vegetable and fruit intake are more at risk of developing diabetes, because, thanks Liza for mentioning that, because they tend to fill up with other foods that are less appropriate and generally high in calorie intake. Sedentary behaviour, and there's lots and lots of research that's going into people that spend long periods of time sitting on computers during the day and doing less physical activity, or spending long periods of time sitting at the TV and watching that are more at risk of developing diabetes. So young kids that are spending long periods of time watching TV and doing less incidental activity are much more at risk of developing diabetes in the future. Smoking also puts people at increased risk of developing diabetes, because each cigarette increases blood glucose levels. So you're more than welcome to refer any clients to me with diabetes. Best practice says that people at risk of diabetes need to do some exercise, and they need to see one of our wonderful dietitians to start managing their weight and to eat more fruit and vegetables. They also need to see somebody that's going to help motivate them to do some exercise, and Kate as well, who's coming up after me, particularly smoking, to decrease their risk of developing diabetes. So there's some wonderful research that says that if people make some considerable behaviour changes and lose some weight, they can reduce their risk they can revert back to normal when they've got pre-diabetes. When they've got pre-diabetes, they're at increased risk of cardiovascular disease as much as somebody with diabetes.